This is Dr. Daniel Paul, orthopedic surgeon with Easy Orthopedics, and today I'm going to talk about what happens if you let a rotator cuff tear go untreated. So the quick answer to that is that it depends on how large the rotator cuff tear is. So what does the rotator cuff do? It's a series of four muscles. It helps keep your shoulder on the glenoid. So a hip joint is your hip is like a ball and socket joint like this. In the shoulder, it's a lot less coverage and it's more like a golf ball on a golf tee. So the rotator cuff will actually help keep that golf ball on a golf tee. And it does some of the smaller movements in your shoulder. The major movements are done by your deltoid muscle. So this rotator cuff kind of just helps center your shoulder where it's supposed to be and helps your biomechanics. So when you have a rotator cuff tear is when you tear the attachment of one of those small muscles. Not really in the muscle belly itself, that's kind of more towards the back, but actually in the tendon part where it attaches. So in the rotator cuff, it's actually essentially mostly tendinous or all tendinous by the time it attaches. So if you tear that and you don't, and let's say if you tear that and don't treat it, what happens? Well, if it's a big tear, let's say a massive rotator cuff tear, let's say you tear your supraspinatus and your infraspinatus all the way through, and there's four muscles. There's a supraspinatus, infraspinatus, subscapularis, and teres minor. If you tear, let's say, two of those all the way through, what will happen is that the golf ball won't stay on the golf tee anymore. And instead of falling off down like you would think, it actually gets pulled up by the deltoid muscle and can lead to something called rotator cuff tear arthropathy, meaning that it will just lead to much faster arthritis of the shoulder. If it gets really bad, the rotator cuff tear arthritis, there is a surgery to fix that, but it's a reverse shoulder replacement. Reverse meaning they just switch the ball and socket, but that's just a technical thing. But again, not everyone is eligible for those. It depends on how old you are. So that's a full thickness rotator cuff tear. It's tearing all the way through, the golf ball comes off the golf tee, and then you tend to get arthritis from that. Now, what if it's a partial thickness tear? Well, if it's a partial thickness tear, for the most part, the rotator cuff still functions to keep the golf ball on the golf tee. So you're not really worried so much about arthritis. In that sense, it's more of a pain generator. So what can happen is that it continues to cause pain in your shoulder, which will throw off your biomechanics, and because your shoulder keeps hurting, you end up with pain behind your shoulder blade too. So it's more of a biomechanical issue that will affect you at that point. Now that being said, sometimes a tear can become stable, meaning that it tears a little bit and stops, and then it doesn't hurt so much anymore, or it keeps tearing and becomes a full thickness tear. So that's what happens with a partial thickness tear. But there's lots of different tears. Like some are like a 20% through, some are 60% through. You can have a tear on the outside of the rotator cuff, which is more painful than a tear on the inside of the rotator cuff. So there's all nuances here. Generally speaking, if I'm treating a patient with a partial thickness rotator cuff tear and it doesn't bother them, I tend to leave it alone. A full thickness tear in the other ways, that's something you want to repair. So I hope I was able to answer your questions about what happens if a rotator cuff tear goes untreated. If you have any questions, feel free to leave them below and I'll do my best to respond. If you like this video, we put out new content every Friday, so please like and subscribe, and thanks for watching.